In this video we're going to be thinking about the blood vessels, considering the arteries and the veins, and we're going to try and learn about the blood vessels by looking at the differences between the arteries and the veins. But before we do that, I just want to talk a little bit about the two sort of circulatory systems in the body. And we've made a note of this on top. Firstly, there is the systemic circulation, and then there is the pulmonary circulation. Now, the systemic circulation is taking blood from the aorta, pumped out by the left ventricle, to all the systems of the body. So it goes to the brain and the spinal cord and the kidneys and the liver and the hands and the feet. It basically goes everywhere except the lungs. So the systemic circulation is perfusing all the systems of the body. But the pulmonary circulation, from the right ventricle, the blood is leaving the pulmonary artery and is going to the lungs only to be oxygenated. So we're going to look at arteries and veins, and we're mostly going to be considering systemic arteries and veins, but as we go along we will point out one or two of the minor individual differences between the pulmonary and the systemic circulation. And the thing to start off with is remarkably easy, remarkably straightforward. An artery is simply any vessel that carries blood away from the heart. It is that simple. So an arterial vessel is carrying blood away from the heart. That is always true. So a vein is towards. It's as simple as that. A vein is any vessel carrying blood towards the heart. That is the definition of these vessels. Arterial vessels taking blood away, veins bringing blood back towards the heart. And that's true whether we're talking about the systemic or the pulmonary circulation. Now, arteries do not have valves. They do not have valves to ensure one-way flow. But veins do have valves. Now, the reason for this is that the blood goes through the tube of the artery under the influence of the blood pressure generated by the contraction of the heart. In the case of the systemic circulation, under the pressure generated by the left ventricle. In the case of the pulmonary circulation, under the pressure generated by the right ventricle. But the veins don't have this luxury because they're carrying blood back towards the heart. So we have to make sure that the blood only travels in that direction, from the periphery back towards the heart. And for this reason, the veins will have valves. And the valves will point up in this direction, pointing towards the heart. So what this means is that once the blood has gone from a lower part of the vein up into the next part of the vein, then it shouldn't be able to regurgitate backwards because these valves will shut. So the valve will open in this direction, allowing the blood to go from there to there. But then if the blood tries to go back towards the periphery, the valve will simply shut. And these valves are particularly plentiful in the veins in the legs and the veins in the arms. Now we want to think about the overall structure of blood vessels now. And a good way to do this is to think about cross sections of the blood vessels. So if you think about an artery here, in the middle we have the arterial lumen. The lumen is the hole down the middle of any blood vessel. And then surrounding the lumen, there's a layer of vascular endothelium, a relatively thin layer of vascular endothelium. Now, the layers of a blood vessel are like coats, the coats of a blood vessel. So they're all called tunica. They're all called tunica. And the one in the middle is called the interna. So this is the tunica interna. Some books will call it the intima. It means exactly the same thing. So that is that first layer. And then arteries are going to have a thicker muscular wall. They have a thicker layer in the middle, and this is the tunica media, mostly made up of smooth muscle and some elastic tissues as well. And then round about the outside, there's another layer called the externa. So we've got the tunica interna, or the intima, the media, and the tunica externa. And sometimes you'll see the tunica externa referred to as the tunica adventitia. The adventitia is the outer layer of an organ. And with arteries, especially the larger arteries, there is actually a couple of extra layers. Around about the outside of the tunica media, there's an extra layer that is largely elastic tissue, because the larger arteries, we want them to be elastic. That's called the elastic lamina. So there's an external elastic lamina around about there, like that. And then in the larger arteries, especially, this is well differentiated, there's another elastic lamina on the inside of the tunica media round there, the internal elastic lamina. And this is made, as the name would imply, made of elastic tissue to make the arteries elastic. Then in the middle layer here, we have mostly smooth muscle with some elastic fibres, a little bit of collagen as well, forming the muscular coat of the artery. So vascular endothelium on the inside, lining the lumen to give a nice smooth flow of blood. Then the media with its elastic lamina, and then the adventitia, or the externa, around the outside. And the externa is largely elastic tissue and collagen. And in the large arteries especially, there are some small blood vessels to nourish the arterial wall, and some nerve connections as well, because arteries are actually quite sensitive to pain. When patients have arterial punctures for clinical reasons when they're critically ill, it's quite a painful procedure. And of course the whole point of the artery is to have this hole down the middle, and this is the lumen. The lumen is the hole down the middle. So that is the cross section of the artery. The whole point is to have this lumen down the middle. Now the larger arteries are sometimes called elastic